if you have the appropriate imaging that's showing that, you have severe valve disease, I really think that if you are having some symptoms, I think that, that really should give patients a peace of mind and say, hey, this is not in your head, that, you have a structural heart problem, and, you have a reason to feel the way you're feeling. My name is Dr. Torabi. I'm an interventional cardiologist at Franciscan Physician Network, and I'm at the Crown Point and Munster campuses. What it really comes down to is if you have imaging and it's showing that this valve is not working well. Let's say, for example, we see a lot of patients that the two most common valve problems we see: aortic stenosis and mitral regurgitation. Aortic stenosis, your heart valve is not opening very well. Mitral regurgitation, that valve is way too leaky. All that blood that's going forwards is going backwards. And if you have the appropriate imaging that's showing that, you have severe valve disease, I really think that if you are having some symptoms, I think that, that really should give patients a peace of mind and say, hey, this is not in your head, that, you have a structural heart problem, and, you have a reason to feel the way you're feeling. Now, if we did this, workup and we didn't find a valve problem, or let's say we didn't find a plumbing problem, a lot of patients, we do this workup for heart valve disease and we find out they have a really tight clogged artery. And that's something that needs to be addressed. And once you do that, then patients start to feel better. But even when we decide to even fix these valves, that's one of the first things we're doing is to make sure they don't have a clogged artery, because, the indication to fix these valves is really with symptoms. And these are the patients that really benefit the most. And I can certainly say that if a patient is noticing they are having symptoms and they have imaging showing they do have severe valve disease, we have to take it very seriously. And sometimes what we do is we even encourage patients to do a exercise stress test. And it's not that we don't believe our patients, but what we are trying to do by offering a test like that is, put the pedal to the metal. Let's see you in action. Let's see how you do on the treadmill. You're going to be hooked up to a monitor. Let's making sure you don't have any sort of high risk EKG findings when you exercise. And maybe if you're not feeling those symptoms, but we see something on the EKG, looking at the electrical rhythm of your heart, that may be enough of a push or a tiebreaker to say, hey, you know what? We've been watching this valve for a while. I think it's time to go ahead and do something about it. I really believe in this adage that, the valve that you've been given, that God gave you want to get as much bang for your buck with the valve you were given. And when it's gotten to the point now where you're having symptoms and you need that valve taken care of, now is the time to go ahead and get that either replaced or repaired, depending on which valve is in question.